Hello, I'm Nikki and I'm the Accounts Assistant for Volunteering in Health. I'm going to give you a brief rundown of our annual accounts for last year and also talk a little bit about how we have been impacted financially by coronavirus. So I'll start by taking you back to April 2019 when Volunteering in Health became a CIO. What that meant for us financially was that all of our assets and liabilities were transferred over to a new charity number. So last year we received over £100,000 in grants. Mostly this was for our wellbeing services, and 2/3 of this funding came from the Wellbeing Partnership. We also received grants from the Dawlish League of Friends for our home from hospital work and from the Coastal Primary Care Network. Our chargeable services, transport and home help, both brought in around £34,000 each in income. However, after deduction of expenses and overheads, both of them reported a small loss. Unfortunately, this does mean that prices will be going up once those services resume. The sitting service, which is supported by Devon Carers, brought in just a little over £2,000 in income. Our donation income was £32,000 and we received about £7,000 from our fundraising efforts. So all in all, our total income was £232,000 plus the assets and liabilities which were transferred from the previous charity. Our total expenditure for the year was £205,000, 75% of which went on our staff. So overall for the year we had a net surplus, so a great position to be in. So thank you to everybody that's contributed to that success. So all of our staff, our volunteers, our donors and our fundraisers, everybody who played a part in making it a very successful year. So turning to coronavirus, how has that affected us? Well, the hospital shut on the 17th of March and our transport and home help services were suspended from the 6th of April. At that stage, 13 of our staff were furloughed, which left a team of 10 people working. Our grant funding for our wellbeing services has not been affected by coronavirus, so that has meant we have been able to carry on. Our transport and home help service have brought in hardly any income at all this year. However, we have been able to reclaim our staff costs through the JRS Job Retention Scheme grant from the government. This year we have not received any donations at all apart from a donation from our anonymous donor, and we have not been able to do any fundraising at all so far this year. So we have received hardly any income under fundraising and donations this year. Just to give you a comparison what that means for us in financial terms, at this point last year, at the end of August 2019, we had already raised £16,000 from fundraising and donations. So we are down on where we would like to be at this point in the year. However, hopefully with restrictions easing, things will start to restart again soon, and we're hoping that some fundraising will be able to be possible and that our donations start to get back up to the previous levels. The good news is though, throughout all of this, we've had no change to our wellbeing services. We have not had to lose or reduce anything, and so it's all good from that perspective. So finally, I will just say if you would like a copy of our annual accounts, they will be available after they've been signed off at this AGM. If you would like a copy, please email me at finance@volunteeringinhealth.co.uk and I will make sure that those copies are sent out as soon as possible. Thank you.